And we've all heard countless examples of frontline workers not getting the equipment they need. This is an example from a Unison care worker just last weekend, and I quote, "I work in a nursing home. I'm terrified. I don't know if residents have a virus. We're wearing homemade masks. This is horrible, and I'm very scared." And that word scared, I think, is one we've all heard many, many times in this last 2 or 3 weeks. This has been a stress test of our resilience, and the government plan is clearly not working. So can I ask the First Secretary to tell frontline workers at risk, when will they finally get the equipment they need to keep them safe?
Getting the PPE to where it needs to be is a massive international challenge that every country faces globally, from China to Germany. And we've done a huge effort to provide, for example, the ventilators, which have bolstered the NHS during this incredibly difficult time. If we hadn't been able to do that, the NHS would not have been able to cope. Since the start of the outbreak, we've delivered 1 billion items of personal protective equipment.
I do understand the challenge of getting the right equipment to the right place every time, but as the First Secretary knows, there's a significant gap between promise and delivery. And over the last few days, it's emerged that British manufacturers have got in touch with many members of the opposition, probably members across the House, saying that they offered to help produce protective equipment, but they didn't get a response from the government. Now, I do understand due diligence and that all the offers couldn't be taken up, but some of those who offered to help are now supplying to other countries. So they clearly could have supplied in this country, and something's going wrong. And there's a pattern emerging here. We were slow into lockdown, slow on testing, slow on protective equipment, and now slow to take up these offers from British firms. The Prime Minister has said this is a national effort, and he's right about that. So in that spirit, can I ask the First Minister to commit to working with the opposition to identify and take up these offers from British manufacturers for protective equipment just as soon as possible?
First Secretary.
Well, I thank the right honourable gentleman, although I don't accept his premise that we've been slow. We have been guided by the scientific advice, the Chief Scientific Advisor, the Chief Medical Officer, at every step along this way. If he thinks he knows better than they do, with the benefit of hindsight, then that's his decision. But that is not the way we've proceeded, and it's not the way we will in the future. And he did make, I think, a sensible point about specifications and health standards. He will know from the reporting that in other countries that have distributed PPE without those high standards, they've been distributed with faults or flaws, they've had to be recalled, and health workers in those countries have had to go in isolation. So I appreciate that he wants to put pressure and scrutinise the government, but I think, and I hope he'll understand, the need to take the right decisions and to scrutinise very carefully the precious PPE that we're putting on the front line to protect our key workers.